to our,
Sorry, got it. Go ahead.
okay. Welcome everyone. Thank you, Ray, for setting this up. Welcome to all our faculty, staff, students, members of our community. I know you're all aware of our School of Dentistry mission, advancing health through education, service, research, and discovery. And we're here today to talk about our service mission, in particular, our service mission of patient care. First, I would like to thank our entire patient services operation. This is really a highly collaborative and interactive, caring team that has been on a bit of a roller coaster, I'll say, over the last 3 months. You know, I think a roller coaster is an apt description of ramping down, and now we're ramping back up. And all of the aspects around that are really quite significant. And this team makes it look quite smooth, I'll say. I also want to give a particular shout out to Patty Dorr and all of the folks on patient services, our faculty and staff, who kept our patients safe and healthy through the last few months with emergency care. That has really been phenomenal. So thank you. So we are a patient-centric operation, and we're committed to safety in that operation. And I think you're going to see that come through very strongly today. We care about the health of our patients, and we're concerned about their really potential gap in care that they may have had over the last 3 months. But we're even more committed to deploying and re-engaging their health in a safe manner. And so without further ado, I will thank all of you who were on for your engagement, for wanting to know, for engaging with us in our operations and making our patient care a safe aspect of our school's operation. I'm going to now turn to Dean Nalia, and I will say that Dr. Nalia is a fabulous person to be leading this effort right now. He's focused on public health and safety. He's incredibly outcome-based and evidence-based in his actions. And he's well networked across our country with other dental school clinical deans, as well as really the important safety agencies, the ADA and the CDC, for our effective deployment. So again, thank you all for your engagement, and Dean Nalia, thank you for taking the time today to interact with our community.
Thanks, Dean McCauley. So folks, you see here our leadership team in the Office of Patient Services. I'm just so grateful to all of them. As the Dean pointed out, they're a wonderful team. It was a team sort of built by Dr. Stefanak, and I was grateful to start working with this team. They're here to serve as panelists, so if you have questions, they will be reviewing those questions and trying to answer you. So please put it in the Q&A. The priority today is to address the questions that you already submitted. And you know, if there are new questions that come up today, if we have time, we'll get to them. Otherwise, we'll get an answer to you afterward. Okay, so had some problems with these slides. So I'm going to present them old school, not in presentation mode. But you know, times are still pretty tough, but I'm grateful now to be here talking about reentry with you all, and preparing for a ramp up in operations. You know, I want to be very clear that the focus today is, you know, overall reentry. So that's very broad. It's not specifically for predoctoral students. It's not specifically for residents or faculty or staff. So I know you may have more specific questions about your own circumstance. Please put those in the Q&A and we'll try and address those. Okay, so this is a graph of the state of Michigan. And as you can see, there's a definite downward trend in the number of new cases, and mortality rate is heading down as well. This is Texas. Okay, Texas reopened on May 16th.
Dr. Nalia?
Yes.
Sorry to interrupt. This is Ray. We're not seeing all of your slides. I don't know if there's a way you can change the view. There we go. I think that helps everybody now. Thank you. Sorry, go ahead.
Okay. So Texas reopened on May 16th, and things have actually been getting worse ever since they reopened, and they're peaking at the moment. And this is North Carolina, similar story. They reopened on the 22nd, and they're peaking now again. And then Washington, unfortunately, Washington very neatly describes the second wave. And this is the whole United States. And you can see that there's a very slight downward trend, but actually in recent times, it's been heading up, and we're at 32,000 new cases. So, you know, all of this to say that the pandemic is not over. This is still a public health crisis. PPE is still scarce. FEMA, the Federal Emergency Management Agency, is still stockpiling PPE for the second wave. And in many places, that's already here. So by now, you'll be familiar with the interim infection control protocols, as well as the document that we released from our office, Safely Returning to Patient Care. And that starts to cover some building-related matters and environmental matters. Our guiding principle has been to protect our School of Dentistry family and to protect our patients, and we're taking a conservative approach to reentry. There's three main things that I'm going to speak about. Firstly, aerosol analysis, which is being done through a collaboration with the School of Engineering. Next is HVAC, heating, ventilation, and air conditioning. And the third is COVID testing. So firstly, the Office of Patient Services has started collaborating with the School of Engineering to complete an analysis of aerosol trajectory and travel. These are just 4 members, socially distanced, of a group of more than a dozen from the School of Engineering. You see, existing research on aerosols focuses on single operatories and traditional private practice settings. There's no strong evidence to guide decision-making in the post-COVID era in dental school clinics. Do aerosols go over intercubical barriers? And more than that, you know, previous research did not study the smallest particle, the droplet nuclei, which is important in the transmission of COVID-19. And results from this testing, which we already have some results, will enable us to make evidence-driven decisions rather than arbitrary ones. So this is an actual photograph now from our clinics. You can see that School of Engineering uses high velocity photography to photograph the trajectory of aerosols from a patient's mouth. Then a separate team of engineers will use computer-aided artificial intelligence to project out the trajectory and the final destination of aerosols. Computer projection is needed because these very small nuclei become too small to photograph. And with these measurements, we will know with more certainty how far aerosols travel in a dental school clinic. And here's some of the things they've accomplished so far. This is information just from yesterday. Phase 1 finished yesterday. There's another 2 phases. So they evaluated the usefulness of existing barriers that separate cubes. What they found is that aerosol does cross over our barriers, and occasionally they actually jump very high. So in the predoctoral clinic, we are going to invest in taller barriers in some segments of the clinics. We're also going to use alternate chairs. This is a decision we sort of finalized yesterday. Clearly, this will reduce the number of appointments our students can have in a given week. And we knew this was coming, but now we have real data to make real calculations and projections. The other thing is when you have taller barriers, this inhibits air exchange. So as a reminder, air exchange, I've spoken about this a few times, but air exchange rate is the number of times all the air in a room is replaced with completely new air and passes through the facility filtration units. This means we will need to augment air exchange inside the cubicles. So we're investing in chairside scavenger units with HEPA filtering. Now we're purchasing a couple of those. That's phase 3 of the testing with the School of Engineering. Okay, and the second phase is School of Engineering is going to evaluate ISO-dry and isolite type units, which are marketed to say that they reduce aerosol. But remember, there was not much concern and worry about droplet nuclei, the smallest particles. And so there's no strong information about those, which we need to have to make decisions. Okay, the second topic is HVAC, heating, ventilation, and air conditioning. With Mike Falk, the School of Dentistry building manager, we've also evaluated HVAC in our building. Some older buildings, and I've worked in ones like this, some older buildings, the airflow goes from room to room to room, and then back to the filter and then distribution. That would be a bad situation. However, we've learned that in our building, air is taken from the clinic straight back to the central filtration system. This is good. And just yesterday, Mike and I discussed with another large healthcare organization about what they're doing to improve building level filtration. So you see, we need a localized plan at the chair side, but we also need a systems plan for the entire building, for office spaces and non-clinical areas. Okay, the third topic is COVID testing. Michigan Medicine is doing a COVID test that is more than 99% accurate, and all elective patients are tested, and then they have to self-isolate for 48 hours because that's how long it takes to get the result. When their tests come back negative, they are treated as though it was pre-COVID times. So, for example, no N95s and no additional precautions. At the moment, we don't have access to highly accurate rapid testing, so this 48-hour test is the best available. Now, if we translate this 48-hour test to a dental setting, there's a lot that we could accomplish. So we could test the patient, require them to self-isolate for 48 hours, and then treat them in designated COVID negative clinics with level 3 mask, no N95. And also we could if we have a designated COVID negative clinic, we could actually book every chair, not just alternate chairs. So this will help our productivity a lot. Now, dental patients may not be willing to self-isolate for 2 days for certain things, like an examination. Okay, so there'll always be a need for taking care of patients with alternate chairs and things like that. But what about something like an implant placement? Or what about if they were having immediate dentures? You see, so there's a few procedures that patients probably would feel warrant self-isolation in dentistry. And then another thing, what if we batched treatments in a different way? So someone, for example, who needed 8 or 9 restorations, but we could offer to do it all in one sitting if they had a COVID negative test result. So I think there's immense potential, especially considering where we are at the moment in terms of productivity. So now, this is information from just last night. Dean McCauley and I have been advocating with our health system, to have COVID testing at the School of Dentistry, for School of Dentistry patients for about 2 months, for actually about 10 weeks. And our health system has its own challenges with testing. But just last night, the health system's chief clinical officer over diagnostic and clinical information, Ella Kazaruni, agreed to allocate resources to test dental patients. Now, I can't give you too much more information at this stage because a lot of planning is needed. And we still may be some weeks away from implementation, but we will have COVID testing available for our patients. Okay, so you've heard some of the things that we're working on. You've heard some limitations. Hopefully you see that reopening a learning center with 10 or 20 or 30 cubicles in one clinical space is exceedingly more complex than opening up a private practice with 1 or 2 closable rooms. So there were some more specific questions that were submitted, so let me try and speak about those. Some of the questions were, when will D4s be back in the clinics? When will D3s be back, D2s? When will, also how can students and residents complete their experiences with the time left? So these are important questions. You know, it would be unwise of me to give an exact date at the moment. It would truly be a guess, and I don't want to guess. I can't really say much more than that because, as you've heard, many things are in flux. In the next 4 to 5 weeks, COVID testing will probably be available. And also, we would have finished our evaluations with the School of Engineering, and we will have our first chairside scavenger units. So a lot of things are going to change. And in that context, it's difficult to guesstimate a date. Okay, so another question is, how much clinic time per week can we realistically expect in the fall, especially D4s? And I guess we could say class of 2021, residents too, will have the same concern. So, you know, when PPE is no longer a limiting factor, we will be working beyond 8 a.m. to 5 p.m. and beyond 5 days a week. And I think everyone should begin to plan for this reality. So, you know, your shift, whether you're a student or staff or faculty, your shift may be 12 p.m. to 8 p.m. You know, so this means that we don't need you to be here 55 hours, but actually the School of Dentistry may have activity 55 hours a week now. But this is absolutely our reality. You know, we have 210,000 patient encounters per year, and those people depend on us. And if we use alternate cubicles only, we will drop to 105,000 encounters unless we expand our hours. Our patients need it, our students and residents need it. Of course, you know, this access to COVID testing, which happened last night at 8 o'clock, will change things a little, and we haven't really had time to process this and think through what it may mean. But we may be able to have some sessions that are designated COVID negative and maximize throughput in those sessions. But the work that we do will always have a number of short single visit appointments that will not warrant COVID testing with self-isolation, I guess, like examinations or even a single restoration. Okay, so there was a lot of questions saying that other schools are fully reopened and why isn't Michigan? And several people specifically mentioned that University of Detroit has reopened. Well, so, you know, I'm in constant communication with several clinic deans across the US, and reading these questions, I actually surveyed them to ask this question: what percentage of pre-COVID clinical operations are you currently operating at? And here's their answers. So you can see that no one's at 100%. And I can tell you that we are about 10 to 11%, but we're in the midst of a significant ramp up. After today, a number of dental students will be contacted. PCCs are working on this. So you see, there's a lot of variation, and we are in the right ballpark. And I will add that Detroit's numbers are on this list, and no one is at 100%. I haven't spoken to anyone at UDM. However, we have it from a credible source that they still have a lot of class of 2020 students who need to fulfill their requirements. And other classes actually not heavily involved in clinical activity. So hopefully you see that many things are promising and that we're working hard on multiple methods to expand activity in the clinics. I've talked about a few. 2 additional things that Brandon and Carly have worked on is reprocessing of N95 masks and using laundered disposable gowns. So firstly, let me introduce Brandon Perry. He's been working tirelessly and answering my phone calls at all hours of the day and night. So thank you, Brandon. So I'm going to turn over to Brandon Perry.
So it's nice to be able to talk with you today and really give you an update as how we're doing school-wide with infection control, especially in the clinics and what we're doing. So thank you, Dr. Naya. We really want everyone to know that we're working hard to develop interim guidelines and adjust our permanent protocols to keep the patient safe and really our School of Dentistry family safe during this time. So there are going to be constant adjustments, and we want you to know, expect that. The more information we know as we continue to have scientific guidance and other from governmental agencies, we'll adjust our protocols so that you're safe and so that our patients are safe. That's our number one concern. But we also wanted to let you know really some of the things, or remind you some of the things that we're doing to ensure that when you're called back to work, when you're starting patient care activity, what's going to be required of every dental healthcare worker. That means the faculty, student, and staff. What's required of them? We really have some prerequisites that we've established so that everyone is safe. So hopefully, I know you've received several emails, and you may have perused, you may have not again got a chance to look at them so detailed, but the prerequisites that we're requiring is that you complete the clinical compliance module. Now that's accessible, or you can access that via Canvas. And so there's links that we can provide that to you. And there's 12 assignments in that module. 4 of them have been added as part of a COVID type to help mitigate COVID related exposures or things like that. So we want you to go back through that and make sure you follow or complete all of those assignments. One of the new assignments that we have, and some have already done this, is a building access agreement. So you may have completed everything else, but a couple weeks ago, this was added, and it's important that you go back in there and that you complete this. Every single assignment in the clinical compliance module needs to be completed before you start work. It's absolutely important and critical that everyone does that. So please work with us on this so that you can get it done. Now, we've received several questions about the N95 fit test. There is a process. I've been able to work with Occupational Health Services, which is for employees, to allow our students to be able to go over there and be fit tested too. But there are certain requirements that we have to do. And so there's a link that's sent to each provider, and then you're able to schedule your appointment. Now, that being said, some people have asked, when can I get fit tested? Well, that's only at the prompting of your program director or your department saying that they're calling you back and they would want you to work into the clinics. When we receive an email from your department or clinic that your name has been selected or student, then you'll receive an email. But until then, we want you just to hold tight, and we're trying to get everyone in as soon as possible. And the reason why we can't call everyone back really goes to our third prerequisite when it comes to coming back into the clinic, is the donning and doffing exercise or competency. Now, we have over 1,000 providers with faculty, student, and staff, and it takes about 10 minutes to do this exercise per individual. So you can imagine it's really a feat that we have to kind of go through progressively, so that so that everyone is taken care of and they demonstrate competency with doffing and donning PPE. Now, this process is done in front of myself, or I have 10 officers who have been amazing, really helping me getting this done. I could not do it without them. So I truly appreciate everything that they're doing. So it allows us to look at the provider, see how we can offer suggestions so that when they're in the clinic, they're safe. Now, we understand that there are several approved ways to doff and don PPE. Now, we have a certain way here at the School of Dentistry, but we understand that there may need to be an adjustment when you're in the patient area. That's okay. The idea that you'll learn in that competency is that to minimize or to eliminate the risk of cross-contamination, really to help you think through the process as to how you can eliminate cross-contamination. That's the main idea. Of course, follow the process, but don't feel as if you're so constricted to that order that if something presents itself, you're not able to make that adjustment. We really think that will help you in that regard. So those are just a few things we wanted to mention to you. The other thing we wanted to mention, and this has to do as you're coming back, is when you're managing injuries. What should you do? Everyone knows it, but we've been out of practice for about 2 to 3 months. So where do you do it? How do you manage? So really briefly, I just wanted to show you our website on My Tools. Everywhere, if you just log in, you'll notice this red button up at the top, report an injury. You'll click that. And if you have a percutaneous injury or a suspected ingestion of a foreign object, you're able to click this button. I'm immediately notified. You don't have to contact me. I'm just notified to say that there's an issue. And then you go through this decision tree. So you don't have to remember what to do. You simply need to remember to go to this button and follow the process. We just wanted to make sure that you're aware of that. The other thing that we wanted to show you is where can you find the interim guidelines at your fingertips. You're able to go here on My Tools under COVID-19, click Interim Infection Control Guidelines, and that will take you to our online manual so that you can find what's required of you while you're here at the school. It also has our infection control manual as well in our clinic procedure reference manual there. So those are the things that we really just wanted to make you aware of. And again, expect there to be changes, but they're going to be changes to keep you safe and the patient safe. Now, we had one question I just wanted to ask, and it was pertaining to something, my work, and it says, will best practices for faculty use of PPE moving from patient to patient with a single clinic session be established and disseminated? So absolutely. We realize that for faculty, you're not going to be in the cubicle or the treatment area the entire time. So we have developed some processes that will help you do that. Now, for each clinic is going to have to decide, I'm working with each clinic, each program director to see what's the best way because each clinic has a different setup. So please know that that will be disseminated through your program director, VIC director, department as to how that faculty or how you as a faculty will be able to move from patient to patient and not providing or not causing too much burden on you as you're removing PPE and putting it on. So thank you so much. We look forward to seeing you back at the school. And now we'll turn it over to Nicole Haskett.
Hello, today we're going to talk a little bit about what it looks like when you return to the school upon entrance. So there's two entrances in. One is what we call the plaza, which is the main entrance off of the parking structure. And the second is, and pardon me, I'm new, it's in the back by the loading docks. What is it called? It's off the Palmer structure. Forum East. So my apologies on that. So when you enter, it's going to look a little different. Like when I got here today, there's like 10 people in front of me standing, waiting to have questions taken. It actually moved really, really fast, so don't be alarmed. However, you should probably leave yourself a few extra minutes in the morning just in case it does get backed up. We have a questionnaire that everybody will be asked every day, patients and employees, prior to entering the building. There was an email sent out with a link that if you download that app, you can answer these questions ahead of time, and then you'll have something on your phone that says you can bypass the questioning process. With bypassing the questioning process, you still have to stop at a sneeze guard. I'm going to share my screen. And this is what it will look like. You will stop here. You will have your temperature taken, and you will be given a sticker to wear. And the sticker is logged with the date. So Monday through Friday, I believe, actually it's Monday through Sunday. So whatever the day is, you'll have to get a new one each day. And if you don't have a mask, then you will be given one. How do I stop sharing this so I can get back? 1 second, please.
There's a red button at the top of the screen. Stop sharing.
Okay. All right, there we go. All right, okay, sorry. So once you get, this is what the sticker looks like. I'm going to show you guys. You'll get one of these to wear. You'll have a mask. And like we said earlier, please, allow a few minutes extra, and please be very respectful of our entrance service staff. They are doing a wonderful job trying to make sure we're all safe. This line also, you'll have patients in line as well with you. So please be respectful and mindful of patients also having to go through the same process. We are also, still, the building is actually still in, renovations, and we have certain stairwells that are for up and some that are for down. That's been confusing for some of us, including me. So they're marked. So this is to encourage social distancing and not have people passing whereby we could still spread this. So that's going to look different to most of you guys who are returning. And I believe that is all I have. I do have a question to answer as far as coming back. The question is, will students still be responsible for contacting their patients for scheduling? And the answer is yes. In this emergency phase, the PCCs have helped a lot with contacting patients because it is simply more efficient. We have a limited number of chairs and sessions, and the PCCs know what those are, so it's more efficient for them right now to coordinate these appointments. Moving forward, when we are able to bring all students back, we will return to the same process where students were able to contact their patients for scheduling. And with that, I am going to turn over to, I believe, Carly. Thank you.
Hi, thanks, Nicole. I'm here just to talk briefly about the new reusable gown and the reprocessing of the N95 mask. But before I do that, I do want to thank all those that reach out to me with purchasing contacts, suggestions, ideas about PPE, and a special shout out thanks to those that were able to actually purchase PPE and to help stretch our inventory. That was a great help. I'm sorry, I'm also getting a message that my internet connection is unstable, so I'll keep moving forward. During these unprecedented times, I didn't think it was possible to network with so many different groups and suppliers to acquire what was needed. It was quite a wake-up call. I did everything from picking up 3D printed face shields and hand sanitizer in the parking lot at Ann Arbor Distillery, to getting overseas calling on my phone. I work very closely with hospital procurement and vetting suppliers, one in particular to make face shields strictly for the university. I'm working closely with the hospital now on forecasting and spot buys to help get us through these difficult times. Unfortunately, PPE shortage is not over. I did talk to dealers this morning, so it looks a little more long-term than we were hoping. We have, though, in lieu of this, put a couple things in place to combat this shortage. One is back to my initial reason I'm here, is one is I'm working with Sewn Linen. They are a longtime supplier for the university, and they have brought out a new reusable gown. So this is good news. We are expecting about 10,000 gowns to be available to Sewn by the end of the month. They will still need time to wash and chip and barcode to get them ready for distribution. The barcoding and chipping will help us track our usage. These gowns, I believe, are going to be good for about 100 washes. I'm hoping that they'll be ready and able to begin using them by the week of July 13th. Please know this is just an estimate, but I am staying in close contact. These reusable gowns will be much more sustainable and environmentally friendly. So I am excited to move forward with that. We also, I've entered into a service contract for reprocessing our N95s. That service contract is university-wide. This will help stretch our inventory as well. I know many departments have already begun to take advantage of this process. And during these learning times, we've learned 2 or 3 very key things to help, and I want to pass those along. To not wear makeup, lotion, lipsticks, anything that'll stain the mask will deem it unprocessable. So then it's just disposed of at the sterilization or the decontamination site. Timing seems to work best. I've got a couple departments that have been very diligent in getting a schedule for reprocessing their masks. They've been like doing Wednesdays and Fridays or Tuesday and Thursday, and then their masks are coming back timely and on a schedule. That seems to work real well. And lastly, the turnaround times have been about 5 days. We've gotten some sooner, but I don't want to go with that just to be safe, but it's been about 5 days. So again, another good piece of information for planning. I think if we all continue to work together and adhere to the guidelines for reprocessing the mask and be very mindful of our PPE use, that we can get through this together. So that's all I have. Thanks very much to all for joining. And I think I'll turn this back over to Dr. Nalia.
Thanks, Carly. So, we've answered about 12 questions. So keep sending in your questions, please. I also wanted to mention, you may not have met Nicole Haskett before. So Nicole is our new clinical services manager, and she's come over from pediatric oncology at the hospital and brings some very, sort of a unique background, having worked at the hospital for a long time, and we're grateful to have her. And she's taking over from Bonnie Dawson. And I also want to acknowledge Bonnie. It's her last few days before retirement. So if you get a chance to shoot her an email, I guess dropping by is no longer a thing, but if you get a chance to shoot her an email, she's been a great servant of this school, a selfless leader and a great servant of this school. She's served on, some of you will know, from clinic issues and various other committees, and we will miss her, but she cares so much about this school. I know that I can sort of text her anytime and still get answered. I've said it to everyone now, Bonnie, so you have to do it. Oh, there she is. Also, I think everyone hopefully knows all the great work, really all of patient services has done. I really appreciate this group, and Brandon Perry has done so much with, staying in touch with governing bodies and bringing those best practices to us. I also want to take a moment to talk about Carly, because Carly has literally saved us tens of thousands of dollars in avoiding counterfeit purchases that other schools and other organizations have succumbed to. But Carly has been brilliant, and she's done so much, and she's working so hard, and probably working harder than ever. And Carly, I appreciate you so much. So there's
Thank you, Dr. Nalia. Thank you.
Welcome. There's a couple more questions, and panelists, there seems to be a couple of Q&As coming up, so please, if you get a chance, take a look at those. So, another question is, could you talk a little bit about how we should be communicating with patients, and how the school is going to communicate with patients? So, we're planning at the moment, this is actually a big project really, but we're planning to communicate with every single active patient with an automated message. So obviously this takes significant coordination, and what we actually need to do is we need to couple it with additional resources on our website. So we're working on updating that information. In fact, it's Ray. Ray is working on updating that information. He's also leading with Dan Bruel and Steve Copera. He's leading, making a video that shows all the things that we're doing to protect our patients. So we want to have more resources there on our website, and then send automated messages using the Telebox system to give a little bit of information, and then refer people to our website for information. So, very roughly, I think we can, as I said, it's difficult to talk dates, but roughly in terms of moving into like a broad scope elective work, it's probably going to be late summer or early fall. But as I said, with so many things changing, it may be sooner. And it may be exactly that. It may be late summer, early fall. We don't want to be, in terms of telling our patients, we don't want to be overly ambitious and say July, or August, because that may not happen for every patient, and that won't look good. It won't look very professional. And the other thing is, we don't want to be overly cautious and say October, because some of those patients may need to seek care elsewhere. So hopefully our thoughtful messaging, and Ray is of course brilliant at crafting these messages, our thoughtful messaging will hopefully help patients understand that a lot is being done to protect them, and that we hope to be able to take care of them, at least by calling them and setting up an appointment, sometime in late summer or early fall. Now, another question was that the our president, university president, indicated that undergrad calendar is changing. And there were questions about, is the School of Dentistry staying the same or changing, whatever. Dental clinics will remain open as usual. Of course, we will observe Thanksgiving and the holiday season, but our clinics will remain open. We received a specific question about external rotations, and just to update those folks, I've asked Dr. Fitzgerald and Dr. Hamrink to think through that. The question was, how are external rotations going to be affected by this? And what's happening with PPE at those sites versus our sites? And so Dr. Fitzgerald and Dr. Hamrink are working on that. Another question was, is there consideration to transition to a procedure-based clinical experience for D4s, i.e. patients would be pooled on the type of care needed and assigned to a student who needs to fulfill that specific procedure? So, truthfully, that is actually how things happen now. That's how patients are assigned at the moment. Patients are screened and pooled by needs in pays. And then we have an assignment clerk, Maureen, who matches student need to patient need. And in fact, there's a function in MyDent that helps to facilitate that. The challenge is that what patients believe they want at the start of a pays visit is sometimes very different to what they end up getting with the student. So, you may have got a patient for an RPD, and unfortunately it may end up being an implant case. That's difficult, and we are actually working on changing that patient intake process as well. But in terms of matching student need to patient need, that's actually how things are done now already. Okay, another specific question was, is it possible to shadow in the specialty clinics? Okay. At this moment, shadowing is really difficult. And I'm only speaking for June and July, right? But if you shadow someone, you use up an N95 mask and a gown, and it doesn't really add to patient care at all. So unfortunately, in this time of scarcity, we have to sort of think about opportunity cost. That same N95 and gown could have been used to treat an emergency patient and resolve their problem. So at this moment, specialty shadowing is challenging. But of course, that's a great way to learn. And so, that's one of our goals as PPE becomes more available. Okay, so that actually takes care of all of the questions that were submitted. So let's take a look at questions that came today. What are the strategies for retaining our patient pool? If dentists all over the state have reopened for elective procedures and D2 hygiene students are back at UDM, why would patients want to be seen by us? Yeah, so hopefully I've clarified the information of what's happening in other schools. As I said, we remain in the right ballpark in terms of our state of reopening, and we are in the midst of an expansion at the moment because about a week ago we released some more PPE that we managed to acquire, and graduate clinics are smaller and therefore more nimble, so they have probably already started to allocate that PPE. For us to do that in pre-doc, it takes a lot more planning, and so our expansion will probably, students will start to be informed in the latter part of this week. And also, I think we addressed the work that we're trying to do in terms of informing our patients about what we're doing to protect them and when we can sort of start to engage them. The other thing is, just to give you the other side of the coin, during the pandemic, we actually acquired a lot of patients for two reasons. A lot of patients said that they felt very comfortable that Michigan was doing research-based, data-driven, protective planning for patients and providers. And so we got a lot of patients that way. And then also, we were one of the very few places that remained open for new patient emergencies. And I can tell you that our emergency services during the pandemic was probably about 85 to 90% new patients, and many of them chose to stay on. So that's the other side of the coin. It's difficult to predict. Of course, I think the reality is that we'll lose some patients, we'll gain some patients, and we'll do our best with the messaging and those sorts of things. Would you be able to speak to when DH4 students from class of 2020 will be allowed to return to clinic? So I think that's 1 or 2 students. And Ms. Kinney, let's talk by email and try and facilitate that. Our goal is definitely to get class of 2020 done. All of the pre-doctoral program is finished, and most of the residencies, and so certainly hygiene becomes another priority. Are the number of the clinics going to drop to half, or are we going to work in different shifts? So I think this is saying, are we going to be at half occupancy? So this is dependent, because as I talked about, and sorry, we haven't had time to really think this through, but we know we'll have access to COVID testing. And so one approach could be to have a COVID negative clinic, because we know that our HVAC system, it doesn't go from room to room. It takes from the clinic back to central and then distribution. And so we could have one clinic that is safe, that is COVID negative, and we could fill that completely like pre-COVID times. So that clinic would not be half occupancy, of course. And then a lot of the other clinics, if we're seeing patients whose COVID status we don't know, yes, at the moment, the interim guidelines, the interim infection control protocol is recommending that. What measures will be taken to ensure the class of 2021 will graduate on time with sufficient experience? So, as we spoke about, we will have to work after hours. Unfortunately, that's a reality. We will do our, we're not going to force anything on anyone, but in terms of the school remaining open, I think our hours are going to be, broader. There's a lot of things that have to fall into place. We can't just say we're opening till 8. Parking, actually, because we don't own our parking. So we're now in negotiations with that. And there's many other factors, but this is our goal, is that we'll be open longer so that students can catch up on missed time. And the other thing I would say is, we care greatly about our educational mission. We care deeply and spend a lot of time thinking about this. But even if we didn't care, the Commission on Dental Accreditation wouldn't let us get away with that, because that's a protective layer for students and residents, in that we have to be answerable to them on the standard of our graduates. So it's hard not to worry at this time, but there are many layers protecting our students, and we want to do our best to give them the experiences that they need to be competent. Okay, a lot is being said about dental students. What about hygiene? Yes, thank you. The truth is, there are no hygiene students here in summer. And so, forgive me for not speaking about hygiene. It is not, it's not that we have forgotten about them. It's just that in the scarcity and all the challenges we face, hygiene, apart from the couple of class of 2020 that we want to take care of, apart from that, hygiene is not a factor for us to have to worry about. But certainly at the time that you are planning to return, we hope to have the opportunities for you to return. So it's not an oversight, it's just that they're not part of the planning in summer because your curriculum is as such. Can students still access the SimLab before full clinic reentry? So I think the SimLabs are extremely busy. I think the answer to this is yes, but I think you'll need to circle back to the academic side, because there is a very heavy schedule on the Sim Clinic. They're working till 7 p.m. With curricular activity. Also, when it's free, we are actually using it for students. Our recent graduates needing to take the CDCA to give them opportunities to prepare for the CDCA. So there's a huge demand on the SimLab. So we can pass this question on and get that information to you. Okay. I'm not sure if there's any other panelists who have anything to add, Dean McCauley or anyone else. or indeed if there's any other questions. We've addressed 21 questions. If there's any more questions, we certainly welcome those.
Dr. Nalia, I just wanted to add to the question that you answered about the external rotation sites. Dr. Fitzgerald and I met this morning along with Dr. Hamrick, and we are going to be vetting every single clinic as to their process, their protocols, to make sure that our students are safe when they go to those external rotations, and what PPE, what's their process. So we want our students to know that that is also a #1 priority, so that when you go out, you're safe here, but when you go to those external rotations, you also are safe. So please keep that in mind and know that we are diligently working for you.
Thank you, Brendan. That's great. Dean McCauley.
Dr. Nalia, I wonder if you might comment. I mean, this is a wonderful venue to have people listening and, putting up questions. What are the best ways for our various communities in the school to keep up to date on the latest information relative to the clinics? So it might be students getting communications one way, staff another way. I mean, what are the best venues for our community to stay up to date on what's going on with patient care?
That's a good question. It makes me think, I'm not sure if we have a great plan outside pre-doc. So I would welcome suggestions from residents and faculty how they want to be communicated to. We tend to communicate when there's a change. We don't necessarily report on the status quo. In pre-doc, there are many ways, passing information through VIC directors, faculty coaches, clinic representatives through the clinic issues committee. So there are many pathways for communication, and of course, students can contact myself or Mary Bennett or Karen Steps directly, and we can try and get those answers to you. But yeah, in the other programs, I welcome some suggestions there. One of the things traditionally in pre-COVID times was that room 1301 was the hub for all problems and solutions. And that is where Karen and Mary work now remotely. Well, not always remotely, they're frequently there. So that could be another touch point. If you're here in the building, there's usually someone in 1301 or at least on that row. And the other thing is you could email them as well.
So there was a comment in the chat about putting up a Google document that can be just updated as updates come through. Might be an option.
Sure. Yeah, that's fine. That's pretty easy to do. Yeah, we're happy to do that.
There's a couple more questions that have been asked, Dr. Nalia. One is it recommended that we, I guess in general, take the antibody test at this time or in the future?
So this is antibody as opposed to COVID test. So Dean McCauley, I don't know if you want to address that.
Yeah, sure. So this may be coming from, we were running antibody testing in the Syndicuse atrium. Bob Eber is running that in conjunction with a lot of faculty and staff. That's over. They completed their studies. Whether or not something else may arise in the future is unclear right now. But what the antibody shows, or the antibody test shows, is really that you've been exposed to COVID. It can't reliably say whether you have immunity to COVID. So it's really better, I think, for research, for population bases to understand kind of the spread of disease than it being a critical component of how we might practice, at least at this point.
Okay, there's one more question. What about DFA? And just to reassure that DFA is part of our School of Dentistry family, and Dr. Dennis Fassbinder has been involved in some of our thinking and decision-making in our response to the crisis. So yeah, DFA is definitely a part of our family, and because that question was very brief, I'm not sure if I'm answering what that person asked, but in terms of what about DFA, we value them just like any other clinic, and we want them to be successful just like any other clinic in the School of Dentistry. Okay, and I saw Melissa Carby said that we can reach out to her for help about that Google Docs. I will do that, Melissa. Thank you. So I think that seems to be working in the research realm. So that's about it. So as I said, I do welcome residents and faculty communicating with us on if the Google Docs works for them, or if there's some other way that they want to be spoken to. We have many processes in place for pre-docs to contact us and for us to contact them, and hygiene too. Hygiene's on that committee, but perhaps not as much with faculty.
Well, the grad program directors should, be instrumental.
Yeah. Okay, so so there's one question: will class of 2021 be graduating on time? So it's certainly, I can't predict the future, but this is our absolute goal. And like I said, we're going to be working after hours and doing our very best. And just as during the depth of the pandemic, we prioritized class of 2020, so now we will prioritize class of 2021. But I can't predict the future. I don't know what will happen with second waves and all this kind of thing. But, we will absolutely do our best for the class of 2021. When and where can this be viewed later? Ray, I assume on My Tools, perhaps.
Yes, we are recording it now, and we will place it on My Tools and send out a school-wide email letting people know where it is with the link.
Okay, so folks, we depend on you, for information, and as you know, we're making changes in a very difficult environment, sometimes with insufficient evidence. And so, like our infection control protocols and different things like that, we appreciate feedback. Like, we value that feedback. It refines our thinking and refines our actions. So today is a meeting to, tell you everything we know, so to speak, but this is not the end of the conversation, because we continue to value that feedback and pushback and questions and comments, because it helps us to push our work to a higher level. Like if you find something that's not working and we address that, then our work is a little bit better. So we appreciate that feedback. So let's keep that conversation going. Okay, thank you, and enjoy the rest of today.
Thank you all.